we have João Abreu, who is presenting Impulso Previne.
Hello, everyone. Good afternoon. Before I get started, give me a show of hands if you have ever been to Brazil. Oh, that's actually surprising. Cool. Thank you for visiting our country. Okay. For those that have been, you hopefully don't know that, and those that haven't been, even more so. But if you have a medical emergency in Brazil, even as a foreigner, and you go to a public hospital, you're going to be treated for free. And if you live in the US, that's very surprising, because you can get a pretty big bill if you don't have health insurance, as you know. And Brazil is also home to the world's largest free healthcare system. No country above 100 million people dared to offer healthcare for free to their citizens, and Brazil has 214 million people. Additionally, and even less well known, Brazil is home to the largest single-entry health database in the world. We are talking about the data of 170 million people coming from a single software and available for healthcare needs. So that's all great, but something is not working. Something is not working because, sticking to the cervical cancer theme we just heard, globally, every 4 minutes, a woman dies from cervical cancer. I want to remember you that every single one of these deaths are preventable because this cancer has a vaccine for it, this cancer is easily screened, and this cancer is usually curable. Still, it's happening every 4 minutes. It happened multiple times since we started this session. Same is true in Brazil. In many regions, it's actually even worse than that. Globally, every 5 minutes, a woman dies from the lack of maternal proper care, and every 20 seconds, a newborn dies from lack of proper prenatal and postnatal care. And as I said, unfortunately, in some regions of Brazil, the rates are even worse than this. So what's going on? We have data, we have a free universal healthcare system. What's going on? It's basically a data-rich but information-poor system. We are collecting all this data. We have all these nurses and community healthcare workers. We're not putting those two together. And that's why we plug in, and our work helps this issue. We answer one simple question with the software we developed: who needs healthcare right here, right now? Just to make it more concrete, that's a screenshot of our software. And in a specific city in Brazil called Pacoti in Ceará, in the northeast, vulnerable, small, poor town in the country. You can see here, obviously, for privacy reasons, this is dummy data. Otherwise, that's exactly what the city has access to. These are the names of every woman that never did a pap smear exam, so a cervical cancer screening, or did it so long ago that it's time to do it again. This is updated every day, automatically, without it having to do anything to us. We just connect to their existing data sets in a way that they don't see the data often. To make it even more concrete, imagine a nurse in the same city in Pacoti called Sheila. Sheila is responsible by herself of taking care for 1,500 people, which is impossible to do without data. In particular, she should be taking care of Maria, who is a person in the city that knows Sheila personally. And despite this personal connection, we learned with our software that Maria hadn't done a pap smear in 20 years. She did it. She tested negative. Luckily. But that was pure luck. If it wasn't for luck, she would be another woman of this every 4 minute statistics that I just mentioned to you guys. We went one step further and realized we could reach people texting them directly. So now we also make sure that people like Maria receive a message on their phones, especially over WhatsApp, and can say, hey, you haven't done this exam. It's important for this reason. Please go do it. We're evaluating this in partnership with Johns Hopkins University, and we saw a 2.4 increase in the number of exams in every city we tried that. This is really exciting. It is also at scale now. We are working in 250 cities, covering over 3 million people, which is, yes, it is exciting, but it's far from enough, because in Brazil alone, we have 1,000 cities waitlisted, meaning they reached out to us and would like to have access to this. We are the bottleneck. And Brazil has 5,000 cities, let alone the rest of the world. That's why our goal is to partner with the federal government of Brazil in the next couple of years, reach 90 million people in Brazil alone by turning this into public policy itself. That's the goal within Brazil that we are trying to get. We have a team of 60 people today, combining tech experts, public sector experts, and people with health expertise that are building this together in partnership with some of the most relevant funders and partners overall that we have. The three things we need to do next is A, to refine our open source strategy to make sure this can reach more cities and more countries. I'm going to skip to the third one. We are also doing a capital campaign to raise $11 million over the next 4 years to make sure we can do this well in Brazil and beyond. And the second one, we need machine learning experts to develop predictive modeling on top of all this data. To end us, I want you to imagine what this second point means more concretely. Imagine if you can say to a health secretary of the city, yes, you have thousands of women that never did a cervical cancer, but you should really prioritize those 50 because they are more likely to have cervical cancer because we have access to the rest of their data, and that's what the evidence shows. With that kind of use of technology, we can finally get to 0 preventable deaths in Brazil and beyond. Thank you.